Hello everyone, my name is Brianna Romo and today I will be presenting a PowerPoint presentation regarding policy and law in healthcare. The role of healthcare policy and law in today's society can be very important. Some of these policies influence the way we receive care, access medicine, reduce the spread of communicable diseases. So an example of some of these policies today are the Affordable Care Act and of course state law regarding immunizations. So these laws are made in order to work towards specific goals. So the state laws regarding immunizations are made with the goal to reduce the spread or completely eliminate communicable diseases. We hardly see chickenpox in today's society. And the Affordable Care Act is aimed towards increasing the access to health care in order to lower mortality rates in America. So these policies are constantly changing in order to address the current healthcare priorities in today's society. According to Porter, Rutkow, and McGinty in 2019, in today's society, the evolving health concern in the U.S. is the obesity rate and the opioid use pandemic. So, how the role of healthcare law and policy has affected today's society. There have been many policies and laws enacted that have had an effect on today's society. So I've listed a few here and what effect they have had. So the Healthcare Quality Improvement Act of 1986, or known as HCQIA, legislators enacted this law to protect medical professionals from peer review related lawsuits and to encourage physicians to be able to file complaints and encounters they've had of dangerous misconduct with their peers. I believe that this has currently helped healthcare organizations be able to truly monitor the quality of care that their hospital and their practitioners are giving and are able to take actions when necessary. So the next act that I listed was, of course, the Affordable Care Act of 2010. This act was meant to increase access to healthcare in order to increase the prevention of illness and disease and reduce mortality. And today's society has drawn some negative and some positive feedback. It has given it's given access to healthcare to some individuals who may not have had access and have gotten some very important things. And to others, it's them paying money that they feel like they do not need to pay because they do not need health care. So the next act that I've listed is the Hospital Readmission Reduction Program. So the HRRP, and that was in 2012. So this has made hospitals take a closer look at readmission and how to compose an action plan on how to reduce them in order to obtain maximum reimbursement. And so, hospitals are going to really want that maximum reimbursement. So they are really trying hard, and I do believe that that increases the quality of patient care. So what are the problems we are having today with policy and law? There can be many problems with healthcare policy and law. Some of those problems include, the Democratic, Republican, and Independent parties do not always agree on healthcare topics, and most of the time. So when they are being made, it can be hard to address all parties' beliefs in one policy. And so due to this, it may not always benefit everyone. And so whenever a new administration come in, these are constantly being revised. And so with the frequent revision of all of these, it can be very burdensome on healthcare organizations. And so according to the National Research Council in 2011, they stated, as a society, we routinely make decisions and implement a variety of policies and programs and strategies without knowledge of their health implications. So this is a big problem because for Americans to make decisions regarding human life, they should have all of the information available to make the most informed decision. So how do healthcare organizations address whenever a new policy is enacted or revised? So what they have to do is they have to create or revise organizational policy and procedures that are compliant with the newer revised law or policy. And then they have to go and they have to educate all of the staff and let them know how they have to change their practice if that is applicable. And then they have to implement, of course, they have to implement everything. So after implementation, it's very important that an organization tracks compliance to ensure that everything's being done correctly, if there's a need for more education, etc. And then sometimes it's applicable, if they need to report it. So sometimes these measures need to be reported to either the state or their accreditation body, like Joint Commission, or the Centers of Medicare and Medicaid Services. So an example of a law being changed due to politics is the Affordable Care Act. It was enacted by former President Obama in 2012 in order to promote the access of healthcare for all Americans. And then in 2017, current President Trump signed an executive order to, quote, minimize the economic burden of the Patient Protection and Affordable Care Act pending repeal. And that was his executive order number 13765 in 2017. So the summary of what Trump's executive order did is it eliminated the requirement that all Americans obtain coverage or face a fine. It gives the federal government less involvement and puts more involvement on the state. And it, quote, encourages the development of a free and open market in interstate commerce for the offering of healthcare services and health insurance with the goal of achieving and preserving maximum options for patients and consumers. And that is directly from his executive order number 13765, 2017. So how does this affect America? So with there being no penalty for having insurance coverage, one can say there can be less people who feel empowered or the need to enroll in insurance because they don't feel that they have to go to the doctor or preventative care is important. And according to Riles 2017, if the current administration completely repeals the Affordable Care Act without having another act in place that specifically enforces insurance companies to provide coverage to those with pre-existing conditions, then those people can completely lose coverage or not be able to obtain coverage in the future. With there being lots of Americans across America with pre-existing conditions, I think it's very, very important that this part of the population is protected and can receive healthcare coverage, because then that will definitely increase our mortality rates and other problems. So to summarize it, Trump really has not changed the base of the structure of the Affordable Care Act, and he promised to do so in his campaign. This can create some confusion and even panic amongst Americans, as it seems with the new news coverage and political coverage of the Affordable Care Act, it's caused a lot of chaos. And so Americans are, needing to do their due diligence and, research to ensure that they are still compliant with the Affordable Care Act so they do not face any penalties. So why is healthcare policy making needed? Healthcare policy making is needed to help guide healthcare and reach desired goals. I would summarize the main goal is to increase America's life expectancy and provide a higher quality of life. So where does America stand? The U.S. life expectancy, according to United States Life Table in 2017, is 78.6 years. And according to America's Health Rankings 2016, the U.S. ranks 29 out of 35 within other countries who participate within Organization for Economic Cooperation and Development. So for how much we as America spends at healthcare and how far advanced we claim we are, I believe we should be ranking better. We have to set better priorities and better goals in order to improve healthcare and improve our life expectancy and the quality of life. So I chose this quote from the first book of Corinthians, chapter 6, verse 19 to 20, English Standard Version. Or do you not know that your body is a temple of the Holy Spirit within you, whom you have from God? You are your own. You are not your own, for you were bought with a price. So glorify God in your body. It is very important that we take care of ourselves to the best of our ability and because our bodies are temples of God. As Christians, we need to feel empowered to voice our healthcare opinions to our legislators so they can at least hear what we want and our needs. Staying quiet will help no one. It is also important to select our representatives that best reflect our values and our beliefs. And that is the end of my slideshow. I hope it was informative, and I want to thank you for your time.